is Dr. Merlindy Brown. I am a family nurse practitioner and doctor of nursing practice. And on today, I will be discussing 3 things that I wish I did differently when I was in nursing school. So I definitely have a good one for you on today. So before I jump into the content, I just wanted to say thank all of you all very much for watching the video on today. I know that you have so many different options and choices when it comes to YouTube videos that you can watch and all of that. So I just want to say thank you so very much for clicking on the video today and watching this particular video. If you've already subscribed, thank you very much for subscribing as well. And if you haven't, then I ask that you would please subscribe by hitting the little subscribe and notification bell below. So I would greatly appreciate it. So we'll jump right into the content. So on today, I'm going to be talking about 3 things that I wish I did differently when I was in nursing school. So for those of you all who do not know, I've actually journeyed through multiple nursing programs. So in 2012, I graduated from my LVN program. In 2016, I graduated from my RN BSN program. 2020, graduated from my MSN Family Nurse Practitioner program. And then most recently, I graduated from my Doctor of Nursing Practice program in 2022. So, and by the grace of the Lord, I actually did very well in all of those programs. Graduated valedictorian of my vocational nursing program in 2012, magna cum laude in 2016, from my RN BSN program and 4.0 GPA in my MSN and DNP programs, all by the grace of the Lord. So I definitely just wanted to provide, nursing students, prospective nursing students with some wisdom as far as how they too can be very successful in nursing school, and then also kind of go over some things that I wish I did that would have made me even more successful. So I'll jump right into the content on today. So first and foremost, the first thing that I wish I did differently and what I would advise nursing students to do is to ask questions. That is so very important. I think sometimes when we're in nursing school, we don't really realize the blessing that it is to have a clinical instructor or a classroom instructor right in front of us. These are individuals who are registered nurses or nurse practitioners, whatever their credentials may be. They have an abundance of knowledge and wisdom as it relates to nursing. So oftentimes, whatever question that we may have, they have the answer to. So if they present, an opportunity to ask questions, which oftentimes they do in school, definitely take that opportunity. I was always an individual. I never wanted to bring attention to myself, and I think a lot of people are probably agree with that as well. A lot of people don't really like bringing attention to themselves, and whenever you ask a question in nursing school, of course, everybody is looking at you, right? But I just really want to encourage you all to just really, kind of block that out and not really be concerned about how other people perceive you or look at you for asking that question, but really take advantage of the blessing that it is to have a resource right in front of you, which is that instructor who can actually answer that question for you. And the thing that I've realized as I've gone through nursing, especially being a new graduate nurse, whether it was an LVN or RN, what I've realized, there are some phenomenal nurses out there. There's some phenomenal mentors out there, but then there are also a select few individuals that you may work with who may not be receptive to you asking them questions. You may be new, you may be working with somebody, and they may not really want you to ask them any questions. They may have their own thing going on, they may be busy or whatever it is. So while you have the unique opportunity to ask questions when you're in nursing school, please do so, because whenever you get out of school, you're going to take that knowledge with you. And that's so very important. So number 2, the thing that I wish I did differently when I was in nursing school is I wish I took more initiative. And what I mean by that is I wish I took advantage of the opportunities that were put in place before me when I was in nursing school. So I can remember in my LVN program in particular, I was one of 10 students, and we actually had, of course, like groups, clinical groups. We were divided into about 10 different students per clinical group, and then we went to clinicals, on our, particular days. But there were always opportunities to perform a skill in the clinical setting. So, of course, we learned how to perform that skill in the simulation lab. But, of course, there were unique opportunities that presented themselves when we were in the hospital or whenever we were in the long-term care setting to actually perform that skill that we had previously learned how to do in the lab. So I can remember there was an opportunity to perform an NG tube and, dropping an NG tube to actually perform that on a patient, that procedure on a patient. And I passed up the opportunity. I think the instructor asked, who would like to do this NG tube? And it was another student, and she was a little bit more, I guess you could say, bold then I was. Just like, oh, I'll do it. And I can just remember, like, wow, she's going to have such a great experience. She's gonna really, just develop such a knowledge on how to perform this skill that she's gonna be able to take with her. And that's something that I really wish that I had took more initiative into. And of course, there were other opportunities that I had, but really, whenever you're in nursing school, if you have an opportunity to perform a venipuncture or a Foley catheter or whatever it is, like, please take those opportunities, because again, it gives you a certain level of confidence whenever you're working on your own. If you've already performed that in school, then the confidence that you have will be through the roof whenever you have the opportunity to perform that as a new graduate nurse. So definitely take initiatives, whatever skills that may be available for you to perform in the clinical setting. Definitely take advantage of doing those things. So, and then lastly, I would say, try to retain, number 3, try to retain as much information and knowledge as you can. So for me in particular, nursing school is so tedious, right? There's a lot of information. I think I mentioned this in a previous video. It's very intense. There's a lot of information that you have to learn about so many different subject matters. And so I think I tried to compartmentalize information. So if I learned something, then I tried to, once I performed that test or did the quiz or whatever it is, I would try to put that information I learned to the side, like in my mind. I try to put it to the side. I'm like, okay, that's that. Let's learn this new thing. Put this to the side. Let's learn this new thing. Put it to the side of my mind so I can kind of make room for the new information that's upcoming. But what I would suggest, especially for those of you all who are interested in going into nurse practitioner school or getting your DNP, everything is cumulative in nursing. So what you learn in LVN school, you're gonna need that in RN school, especially in an RN to LVN to RN program. It's all gonna build on each other. If you're in RN, what you learn in RN school is you're gonna need that when you're working on your BSN. You're gonna need that when you're working on your nurse practitioner degree. You're gonna need that when you go into the DNP or PhD program. All of it is cumulative, and I think I can remember going through my nurse practitioner program, and I was like, wow, like you can remember different things, like even more so in particular, like anatomy type of things, because there may be I know, like in NP school, there may be a patient that's coming in with a rash, right? And it may be like a vesicular rash, which is kind of like a rash that has like an erythematous base, and it has like blisters within the rash, if that makes any sense. But I can remember oftentimes if it's a herpes viral rash, then it follows a certain dermatome, right? Well, you learn about like dermatomes, and you learn about like anatomy and different things like that, even in like LVN and RN programs. But oftentimes you don't really need to use it necessarily in those programs, so you just kind of put that to the side in your mind. But what I would really, really, really advise you all to do, whether you're going further into nursing or whether you're not, really try to retain as much information as possible, because realize that it is cumulative and you will need it at some point in the future, whether it's A&P related, whether it's pharmacology related, whatever it is, you will need that as well. Pharmacology is super, super, super important, especially if you're going into being a nurse practitioner, because again, I mean, of course, if you're learning how to treat patients who have high blood pressure or high cholesterol, then the medications that you actually administered when you're a nurse, you might administer atorvastatin, you might administer metoprolol, right? When you become a nurse practitioner, you're going to be ordering metoprolol, you're going to be ordering atorvastatin, as well as numerous other drugs. But you're really going to need to know about the chemistry of those medications if you decide to go further into nursing. So if you have a baseline understanding as a nurse, okay, metoprolol is for high blood pressure. Then once you get into nurse practitioner school, then you realize, oh, okay, it's a beta blocker as well. So it's going to do certain things to actually reduce blood pressure. And then if you know that atorvastatin, or you're an LVN or RN, if you know that atorvastatin is for cholesterol, then you realize in NP school it's like, oh, it's an HMG CoA reductase inhibitor, so it actually inhibits cholesterol synthesis, right? So you'll be able to put those pieces together. You know what the medication is for, and when it should be given as an RN or LVN. But then if you remember really like the indication for that medication, then you can build on that a lot easier when you're in nurse practitioner school, because you have that baseline understanding. So try to retain as much information as possible, realizing and recognizing that it is cumulative and it will pop up at some point later in your professional career, especially if you are planning on pursuing an advanced degree, whether a nurse practitioner degree, CRNA, DNP, whatever the case may be. So I pray that all of you all really found that content to be helpful. If you have any other content ideas, if there's anything in particular that you want me to discuss, whether it's about nursing education, whether it's about nursing school, or just healthcare in general, you can leave me a comment in the comment section below, and I'll definitely try to put some information together and provide you with a great video regarding that subject matter as well. So again, thank all of you all for joining. If you haven't subscribed already, please subscribe to my YouTube channel by hitting the subscribe button below. I greatly appreciate it. And until next time, thank you all and God bless. Bye-bye.